the big stuff. Who do you think you are, Mr. Big Stuff? You're never gonna get my love. Now because you wear all those fancy clothes, oh yeah, and have a big fine car, oh yes you do now. Do you think I can afford to give you my love? Oh, you think you're higher than every star above, Mr. Big Stuff? Who do you think you are, Mr. Big Stuff? You're never gonna get my love. Now I know all the girls I've seen you with. I know you broke their hearts one after another now, bit by bit. You made them cry. Many poor girls cry. When they try to keep you happy, they just try to keep you satisfied. It's the big stuff. Tell me, who do you think you are, Mr. Big Stuff? You're never gonna get my love. I'd rather give my love to a broke guy that has a love that's true. Oh, yeah. Than to be fooled around and get hurt by you. Cause when I give my love, I want love in return. Oh, yeah. Now I know this is a lesson, Mr. Big Stuff, you haven't learned. Mr. Big Stuff, tell me, who do you think you are, Mr. Big Stuff? You're never gonna get my love, Mr. Big Stuff. You're never gonna break my heart, Mr. Big Stuff. You're never gonna make me cry, Mr. Big Stuff. Tell me, just who do you think you are, Mr. Big Stuff? You're never gonna get my love, Mr. Big Stuff. You're never gonna break my heart, Mr. Big Stuff. You're never gonna make me cry, Mr. Big Stuff. Tell me, just who do you think you are, Mr. Big Stuff?
Time goes by so slowly. 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 Time goes by.
Please take your seats. The program will begin shortly. Please take your seats. The program will begin shortly. Please welcome to the stage Bertha Coombs, CNBC.
Hello, good afternoon, everyone. Thanks so much for joining us this afternoon. I think we're going to have some wonderful conversations here on an issue that is close to most of us. I just want to take a little quick, just to introduce myself. I am the senior healthcare reporter at CNBC, but I was also a caregiver to my mom. She passed away, but I have to tell you, it was one of, as someone who didn't have kids, it certainly opened my eyes to how differently you see the world when you have that responsibility. I went for a mammogram one day and I had to have a follow-up, and my first thought was, I can't be sick because no one else is going to take care of my mom. I didn't think of myself first. I just wonder, how many people here are caregivers to a parent or an older loved one? So this conversation really resonates for all of us. Let's get things started, though. I would like to welcome to the stage now Governor Lujan Grisham for opening remarks here. She has done so much work on this issue. Please welcome her.
The box. Everyone in New Mexico is very familiar with a box for me to stand on. Thank you for that kind and warm introduction, and I'm incredibly honored to be here because this is a topic that in rooms where we're talking about healthcare and long-term care and Medicaid and Medicare reforms, you know, it's more of a natural setting about what we need to do. And like so much of our healthcare and healthcare discussions, it's about chasing money and reimbursements and trying to realign a system. What's happening, I believe, in this panel and with the Clinton Global Initiative is recognizing that we're seeing the graying of the globe, and quite frankly, before 9/11, which we probably ought to talk about a little more. New Mexico's home to 2 of the 5 national labs. The national labs were all collectively working on what we do about aging and not having a workforce and the potential for a total collapse of economies all around the globe related to the consequences of an aging population and not figuring out families, care, supports, work, and so many other issues. And then that was blunted, and here we are 2 decades later, and there are still sizable challenges. But I want to talk about some opportunities, but Bertha, me too. I was a caregiver for my adult disabled sister, Kimberly. She died when she was 21, but suffered from brain tumors that in the 60s were difficult to manage. And so the kind of care that saved her life also created significant disabilities, including significant hearing loss, and she was blind. And then I moved in and took care of my father until he died while I was working full-time and a widow and still had daughters at home. And then after my father died, I realized that because my sister blew through her insurance by the time she was 3, that my parents had been cobbling together as caregivers a financial plan that didn't quite work for them, but always worked for my sister. And they were underwater, and as the oldest, I had no idea. That meant that they didn't really have a house. They were in foreclosure. And my mom didn't have any income because what did she do full-time? She took care of my sister. And so now I'm in a situation where I'm the caregiver and my mother's got no place to live. So I built a house in my backyard and got to return a little bit to sort of high school, where my mother was very interested in where I was after 10 o'clock. Had to remind her that I was a 40-plus-year-old woman, and after 10 o'clock was just fine. I didn't have a curfew anymore, but it's startling to have your mother on your back porch wanting to know where you are. But she was also having such significant issues of her own. And her own long-term care needs and her cognitive decline created clinical depression and a number of issues, and I was in Congress. And the reality was, even though I was hiring in-home care and I had her on waiting lists for Medicaid and I was trying to navigate it all, and I had neighbors and friends and my kids coming in and out, while I had a large support network, the truth is that's complicated to manage in and of itself, and also hard on the person that you're providing that loving care to. And I was far away, so I needed to be closer. And long story is, my mom eventually went to an assisted living that was part of a better program of all-inclusive care, which is a national program. But I'm still the eyes and the ears. That means calls, that means frustrating moments, that means not understanding where the therapy is, that means seeing medication mismanagement, and that means seeing that my mom's not getting enough socialization, and that means that I'm really mad about all the other residents. Last thing, and I promise I'm gonna get to the opportunities. I spent 14 years at a cabinet secretary level at doing aging work for 3 different governors in New Mexico. And I was so mad about our long-term care system, particularly the institutional care side, I went undercover as a resident. And the places I went undercover lost their licenses shortly thereafter, because I was horrified about the issues I always knew about as an advocate, but regulators don't keep up with advocates and sometimes don't pay attention to family caregivers, or to, quite frankly, they don't listen to the residents themselves. So today, we're going to talk about what we can do globally and economically. So I think you're going to hear about, first of all, retirees are incredible. And as we're aging in place, we need more opportunities for community engagement, which keeps us healthier. So let's do a lot more of that. 2, invest in your families using technology supports, education, and training, and the kind of volunteer commitments where, how about if you are a 22-year-old? Well, how about if you're an 18-year-old and I place you with the Navajo code talker? I think there's only one left. This was a concept I had many years ago in Congress, because the relationship, we have to develop respectful intergenerational relationships for this population if we're going to get it right. And lastly, the social services network has not kept up. And if we keep it up, we're not going to spend $600 billion a year. A lot of the issues are preventable. And the caregivers, who are largely still women and women of color, it is not a sustainable model, particularly as we're building a workforce into the future. We have to get back to the basics and support families who will provide care. And 3 quick things, and I'm way over my time, that we do in New Mexico. 1, I have a Medicaid model that pays caregivers. I have a non-Medicaid model that's called New Medicare, so I don't care about your income. You got a family member that is having to manage part-time work and you, I need them to continue to build their Social Security and their retirement incomes. State will pay you, because we save money on all the other systems and we create staying at home. We're also building small, tiny, long-term care living environments that really actually do look like your house. We're doing it with veterans and other populations. They're happier, they're healthier, they're engaged, and providing additional caregivers is easier to do because I have a much happier environment with which to provide those services, including caregivers who get to be paid and live in. So those are a couple of the things that we're doing in my state. You're going to hear about a bunch more. I'm really grateful to be here. I'm grateful that you let me go on too long. This is an area that is important to me, and I know that it must be equally important to you. Thank you all for being here, and thank you.
Thank you, Governor Lujan Grisham. Right now, I'd like to introduce a CGI commitment to action maker. I'd like to welcome to the stage Sujal Kapadia with Jivan, and he's going to come and inspire you for a few minutes.
Hi, folks. Good afternoon. My name is Sujal Kapadia. I'm the co-founder of Jivan, an older adult employment platform. I want to start by telling you a little bit about my inspiration, which is my father. Growing up, my father had a vibrant career. He was going at 100 miles an hour, and he loved what he did. And then he retired, and he suddenly found himself at age 60 going from 100 to 0. That transition was incredibly tough. He spoke up every day trying to figure out what his purpose was, what his mission was, how he was going to stay productive. He tried his hand at other employment opportunities in entrepreneurship. Nothing, unfortunately, really panned out. These images of my father stuck with me, and they opened my eyes to older adults everywhere. And the more I observed and read, the more I realized that this story was not unique to my father, that older adults everywhere were experiencing this type of story. So what are we doing? We're on a mission to change this story, to create a world where older adults can find employment that meets them where they are. In addition to income, employment can help older adults to feel productive, find purpose, stay productive, build social connections, and stay sharp. And this mission will positively impact a huge number of people. There are currently 1.9 billion people globally who are 50 plus. Just in the United States alone, there's 120 million people 50 plus, which represents 36% of the population. Many of these folks, unfortunately, need extra income. In 2021, the poverty rate for those 65 and above actually rose, whereas it stayed the same or fell for younger demographics. So in 2023, a year ago, we launched a CGI commitment to action to place 100,000 older adults into employment over a 5-year period. So how are we doing it? In the near term, we're spending lots of time with employers discussing the benefits of hiring older adults. We've partnered with a fantastic staffing firm called Eclairo to help us place individuals within this demographic into employment. In the longer term, we're building a scalable, user-friendly portal that will upskill older adults on a variety of hard and soft skills. Think the Google and Microsoft suite of products, building an effective LinkedIn profile, having a really good elevator pitch. We'll also create a robust, technology-enabled matching engine to help us place older adults into employment at scale. We envision a future where we've broken down barriers to employment, combated ageism, and given all individuals the opportunity to work as long as they'd like. You folks can help by referring employers in any industry to hellojeevan.com so we can partner with them to meet the goals of our commitment. Thank you very much.
The other great thing about working when you're older is that it also gives you community if you're in a job that you really like and you have coworkers you like. So let's talk about our first panel here. We're going to explore how an increase in aging populations globally is impacting and affecting healthcare systems and how we can drive solutions. So welcome to the stage, please, Deborah Whitman. She's the Executive Vice President and Chief Public Policy Officer for AARP. She's an economist and expert on aging issues and the author of a brand new book just out, The Second 50, Answers to the 7 Big Questions of Midlife. Deb? Next is Nima Ruhi. He is the CEO of Blooming Health. He has a background in AI and data science, but his caregiver experience pushed him to found Blooming Health to find better solutions when it comes to caregiving for folks who are getting older. Thanks. And finally, we have the administrator for the Centers for Medicare and Medicaid Services, also known as CMS, Chiquita Brooks-LaSure. She is a longtime policy official, starting in the House with members of Congress in the Obama administration, and one of the people who did help bring forward the Affordable Care Act, which launched in terms of people getting coverage 14 years ago this fall, or 10 years ago this fall in 2014. Let's get my papers together here. Deb, I'm going to start with you because you've got data, and I always love to start with data. Those numbers really help tell the story. Can you talk a little bit about what the major global trends are? Here in the US, we already have double digit in terms of people over 65 percentages, but in some parts of the world, you're talking 1 in 3 people over 65.
Yeah, and I'm going to use my safety blanket because I like to get my numbers right. But you're right, Bertha. So it's not just aging today, but it's aging in the future. So globally, right now, the number of people 50 and over are projected to increase by 70%. So today we have 1.9 billion people, and that will grow to 3.2 billion by 2050. Now, this is the fastest growing natural resource that we have on the planet. You know, if we think about the issues that are facing us, the demographic change and climate change are probably the 2 greatest forces. One, to me, is positive and something that we can do something about, while the other one we talk way more about and are putting together plans and other things in place. And one of the things that people don't talk about is there's countries that are old today, and there's countries that are young today who will soon grow old. So if we look at lower and middle income countries where we've seen such a huge increase in youth bulge, it's probably not a surprise that they're going to have birthdays too. And so the largest and fastest growing countries of an aging society are in lower and middle income countries. And in fact, by 2050, 80% of people of the world's 65 plus population will live in lower and middle income countries. And this earlier this year, I got to travel to Kenya, Tanzania, and Zanzibar, and you're going to hear from my colleague Carol, who helped us understand what was going on in another session. But I think as we think of global aging, we can't just think of the countries that are old today. We have to look at the future. And we need to frame aging in a way where it's not just a crisis, but there's huge economic opportunities, both for the private sector, because by 2050, 40% of GDP will be driven by the 50 plus. So it's a huge opportunity for businesses. As you heard from Sanjal, there's going to be a huge change in our workforce. We now have 5 generations working together for the first time. And it's also a huge change for individuals. Think what you can do with an extra decade of life. We've gained 3 decades just since the 1900s. And if we continue to invest in health and education, we can even extend that further.
But, you know, a lot of us were born back in the 1900s, although...
Not even close.
Although we have a longer lifespan, health span isn't always necessarily great. And, you know, Madam Administrator, you certainly know this very well. Of the estimated 61 million seniors on Medicare, 7.2 of them are also on Medicaid. Another nearly 5 million are on Medicaid due to disability. That's effectively their long-term care. So 15% of them are dual eligible with real serious health issues.
You know, it is one of our major issues in our country are income disparities, and those how that connects to aging and how we take care of healthcare is a growing concern. And I feel like we all got that lesson through COVID-19 with really seeing what happens when the least among us do not have the healthcare that they need. And I would say that the way we at CMS, our mission and our goal is to make sure our programs are really providing people access to the care that they need and that it is affordable, because it's interesting. I was thinking about this topic. What happens with our nation's elders is not limited to those people who fall in that category. It is a multi-generational issue. A couple of months ago, we did a panel talking about the effect of the drug negotiation, and there were young people on the panel talking about worrying about their grandparents, worrying about their relatives, and the impact that that has on the family. And so you started by talking about how so many people are caregivers today. And one of the things that we at CMS are trying to do is really acknowledge the role of the caregivers and all of the workers who are helping the people who are covered by our programs, because that's a key piece to making sure that people get access to the care that they need. So just to name a few of the things, we started for the first time really shepherded by Dr. Biden, who I know is also here, really wanting to make sure that we had patient navigation services for people with cancer and other chronic diseases. That at that point where you hear that scary word of a diagnosis, that there's somebody else that's helping you to navigate, and that we're paying your providers. We are also thinking about the caregivers. We launched a model earlier this year called the Guide Model, which is really designed to support caregivers for people with dementia. And I will say, like, the outpouring that we have gotten, we didn't know when we put the model on the street whether anyone would be interested, and we had so much interest. We are having multiple years of cohorts because we had too much demand. And I think one of the reasons for that was because people need support. They need help knowing when my relative is in the middle of the night having an issue, I need someone to call. And that's one of the things that the model is paying for, and really trying to coordinate care. So I think as a country, we really need to make sure, A, that the least of us, the most modest income people, are getting access to the care that they need. Again, it's important for all of us. It's really important for our economy, and important that we support the caregivers, the workers, the doctors, the nurses, to make sure that they are in a position where they are able to deliver care, as well as, of course, making sure it's affordable for the people who need their care.
You know, I don't know about any of you, but I would imagine you've probably become your loved one's chief resident, right? When you wind up in the emergency room, you know what the titration is on their medication, what's changed, updating things that don't get updated in the chart, and suddenly, you know, here I am, someone who is very much humanities. I never even went to a biology class in college, and I'm having to remember these things. But, you know, Nima, one of the things I found that was really helpful was cobbling together technology. So to be able to have it was an Amazon Echo that had the screen, so I could just drop in. So if my mom was having a visiting nurse, I didn't have to leave, I didn't have to just be on the phone, I could see her and she could see me in the environment. Or if suddenly she was out of something that she needed for home, I could go to one of the shopping apps and it was delivered before I had my first hit on the air, and I didn't have to miss a beat. How are you leveraging technology for older folks and for those caring for them?
Yep, so let's first recognize that technology is probably the biggest sector of economy right now that have overlooked older population as a segment of consumer by and large, basically. We haven't done a great job building technology that works as good as it does for a 20-year-old to do the same job for a 80-year-old, right? Why does that matter? It matters because today technology is basically the gateway to most of our everyday services, as you mentioned. Most of us here buy our food, get our transportation, do our banking online. Yet our friends at AARP found out a couple of years ago in 21 that 22 million American older adults still don't have access to internet. Around 42% of older adults during the pandemic were not able to access any of their online services from their home. This is a broken system, right? And basically, when you shut down the gateway to such kind of vital services to a segment of population, what happens is you break down access and you break down efficiency. So the cost goes up. This is what actually inspired us at Blooming Health, me and my co-founders, Naman and Kavitha, that are here too. We started on this journey as first-hand caregivers and as people that have had people in our family that had issue with technology, wanted to get care they needed. And we started building a platform that can actually be as flexible as possible, that can meet older adults where they are, independent of where they live. If it's rural, if an older adult is not speaking English, if they don't have access to internet and they just have a landline, we still need to be able to care for them, right? And there's still a lot of untapped opportunity in this space, in the technology space, that can enable our care delivery models, that can enable our financial services models for the aging population. And that's been our inspiration in the past few years. In fact, we started at the peak of the pandemic in New York City, in East Harlem. And then today we're serving around 350,000 older adults in 17 states. And we already have another 1 million people to serve that are, a lot of them are actually dual eligible populations.
And what do you do on the platform?
Basically, the platform we've built is a digital tissue in the communities that connects community-based resources to the older adults through phone calls, believe it or not, through text messages, through emails, independent of what an older adult has access to, and in 80 different languages. So we're basically trying to power community-based organization who older adults trust a lot. They, in fact, told us, a lot of older adults told us they trust community-based organizations more than they trust their children. Because they don't want to be a burden for their children. Right. Not that there's a lack of trust in the family. It's important. It's important to know how, what models exist in the communities and then what role technology can play. So we decided to build a platform that automates a lot of social work, automates a lot of caregiving. So frees up a social worker in a community where you have 2,000 older adults living from entering data, screening people, and so on and so forth, to actually providing care. And that way you could actually keep up with the growing demand as we have this growing demographic of the population.
You know, it's interesting. I think about the fact that, you know, those of us at the end of the boomer cohort are more technologically savvy. I think for all of us, whether you are or not, the issue becomes, can you still be independent? And I think that's the hardest thing about getting older, is when you lose your autonomy. Are you finding that when you were researching your book, that people are trying really hard to hold on to that?
Yes, and not just their autonomy, but people also want to stay in their home. Which are related, because most of the homes that we've designed in this country are built for single families, and they have things like stairs, like I have in my house. And so once you can't climb stairs, you can't live in that house. And also with autonomy, we do have to be careful of how do we support the autonomy and the choices that people still have. So as you are caregiving for your family member, you know, being able to ask them the things that were important to them is a crucial part of aging, because nobody wants to be turned into an infant. Nobody wants to have choice their whole life and be an adult and then lose that. And so we need to look at the way we're designing systems and choices in a way that can support people. And I'll just say a point about Nima's research that he mentioned. A big part of what's keeping technology away from older people isn't that they don't know how to use it. In fact, we saw huge increases in the early months of COVID when suddenly everybody learned how to Zoom, right? Even with grandma. But broadband access.
Grandkids are definitely a big incentive.
Grandkids are a huge incentive, and having other people help you walk you through what it is. But you know, most of the new old, younger old, which I am since I've happily passed 50, have been using technology for decades. We still have issues of people not having money to afford broadband. And there were huge subsidies during the pandemic that are expiring. And I really worry that the issues that Nima was talking about is as those subsidies go away, it does take away people's independence, connectivity, ability to remain engaged in their community. So I think autonomy is this whole ecosystem that we have around us. It's our community, it's our home, it's our ability to connect with others through technology.
And Chiquita, what are some of the things that CMS is thinking about with regard to this? I know that CMMI, the Innovation Center, you helped craft that. They've looked at a lot of these issues with regard to the social determinants. And I have to think that connectedness is one of them.
Absolutely. And one of the things we're doing, not just in the Innovation Center, although that a lot of the work that the Innovation Center did is now bleeding over into the other parts of the program, is really making sure we're looking at people holistically. So it's not just, I'm coming to the doctor and we're going to just look at the health, the medical issue. We are going to ask questions like, about food insecurity, about your housing. I mean, those are the top two. There are several social drivers that really determine some of these key questions about whether you'll be able to access the services that your doctor, your nurse is going to tell you to do. So we increasingly, whether it's in Medicare and Medicaid, really are leaning into that. So many states over this last year have gotten waivers from us to provide what I call health adjacent services to make sure people are getting care where they need it. Home and community-based services, there's such a strong desire for that, and there was new authority in the American Rescue Plan, which states are taking up, to really make sure that people more and more can get care in the most appropriate place, because we tend to, as healthcare systems, as the payers, how it's been established, we pay when you go to the hospital, we pay when you're in the nursing home, but so many of what people want, particularly the baby boomers, I think, which I'm trusting all of you will usher in a new age so that we modernize our healthcare systems and programs to treat people where they are and in the most appropriate setting and pay for the things that that people really want, again, so that it's a multi-generational thing. It's also important, I would say, not only as we look at the aging population, Medicare now, we're covering, as you said, 66 million people, most of whom are seniors, but some of whom are people under the age of 65 with disabilities. In 2060, that goes to almost 100 million people. We've got to make sure that we are building a Medicare program that is sustainable for the long haul, and that's also a lens and a thing that we think about, which was part of the push for our ability to negotiate drugs. Part of it is because seniors are struggling with costs. Also, we need to make sure that the Medicare program is sustainable for the long term.
And we've got 9 seconds, so Deb, I want you to give people, you've written a book, you're ARP, you've seen the data, give people something actionable that they can do to try to help push this forward.
Read my book. No, aging is a complex process, which is why in the book I deal with questions about how long you're going to live and how long you're going to work and will you be healthy and will you lose your memory. And I try to give practical solutions for individuals. And then I have a whole last chapter, Chiquita, of all the policy things that we need to do. I think we need, if I was going to give one thing, it would be we need to think differently about aging. And we need to think differently, not just because it's good for the economy, like I said, or good for employers, but it's actually a health promotion. So if you view aging as a positive thing, a time of wisdom and purpose, you live 7.5 years longer. you have lower rates of heart attack, you have lower rates of dementia, and it also makes you live a better life. And so we need to really reframe the way we talk about it as a plus and not a minus.
Thank you so much. Great note to end on. Thank all of you. Please give a round of applause to our wonderful panelists. All right. Now, if I can find my correct page, we are going to move on with our program here. And here I am. Next, we're going to hear from a member of the 2024 CGI Greenhouse cohort. CGI Greenhouse supports entrepreneurs from growth stage social impact companies from across the globe working to accelerate and scale their innovative technologies and business models that aim to solve critical global challenges. Enterprises recognized by CGI Greenhouse are examples of what's working around the world to build a more equitable and resilient future for all of us. Please join me now in welcoming Camilo Fonseca from Porta.
Hello, everyone. Thank you. So, what's working? For us at Porta, what's working is prioritizing those who are aging and prioritizing their mental health. At Porta, we have developed immersive experiences for anxiety management in oncology patients and people affected by dementia. We're dealing with the anxieties those populations experience using technology, specifically using virtual reality and artificial intelligence to improve healthcare delivery and quality of life. We tested our solution with 200 oncohematological patients in the Hospital of León, Spain, some of them in palliative care. The results were both humbling and encouraging, with 90% satisfaction rate. People felt deep gratitude and perceived our solution as a gift. We were helping patients go through their heavy treatments and hospital loneliness, but also we were helping doctors and nurses by improving their patients' moods. Last year, we won the Longitude Prize Discovery Award on dementia that led us to a co-design process with people affected by dementia and caregivers in Colombia and the United Kingdom, when we're now hoping to scale our health tech solution. The insights we gathered from that process reinforced our belief that all health is deeply connected to mental health, even and especially in extreme circumstances like Alzheimer's disease and dementia. As we scale our work, Porta is improving quality of life and promoting economic inclusion and health equity for these groups of people. In most places around the globe, mental health treatment is considered a luxury, and it should not be. We live in an overstimulated planet, bombarded by algorithms, and society as a whole is feeling anxious. So why not take advantage of the extraordinary and ubiquitous tools that technology is bringing every day and make them available to everyone in need, to help them feel better, to help them live better, to help the world heal. So let's keep working on what's working. Let's work on dealing with anxiety. Let's prioritize the most in need. Let's say mental health first, mental health now, and mental health for all. And let's do it together with Porta as part of the solution. Thank you all.
Felicidades, it's a wonderful cause to be involved with. We all think about technology often making our lives so much more anxious. if we can use it to combat that, that's such a gift. Next, we're going to hear from another CGI commitment maker. Please welcome Diki Settle with Medic.
Hello, everyone. I'm Dickie Settle, board member and interim CEO at Medic. I'm delighted to be here with you today to showcase what's working for universal health coverage. In 2012, we made a $1 million Clinton Global Initiative commitment to action to build a model for technology-supported maternal and child health services in Liberia. Today, the technology we introduced to the world then has been adopted for scale by multiple governments, reimagining how care is delivered at home. The Community Health Toolkit, or CHT, is an open source software platform that allows partners and governments to build and deploy digital health applications tailored to local needs. Programs across 18 different countries currently use the CHT to support 163,000 community health workers and over 80 million people. As community health workers travel door to door around the world, they use CHT-powered apps to monitor pregnancies, treat malaria, track vaccinations, and refer urgent cases. When community health workers are salaried, skilled, supervised, supplied, and strengthened with high-quality technology, exceptional care is delivered. At health facilities, staff can use CHT-powered dashboards to view patient histories, manage referrals, and coordinate care. At the national level, near real-time data informs rapid responses to disease outbreaks and guide resource allocation. It opens the door for precision public health. In Kenya, where the national government has raised the bar for digital community health, we've worked with countless partners to design and roll out a national community health platform across all 47 counties under the leadership and direction of the Ministry of Health. The technology does more than digitalize health workers. It connects communities into the Kenyan national health system in new and profound ways. This is the power of commitment, partnership, and community-owned digital health tools. Building on Kenya's extraordinary success, we're aiming higher. By 2030, Medic will support 500,000 health workers, expanding access to improved health care for 250 million people. We commit to transforming the CHT into a community-owned, led, and developed digital public good through a robust network of developers and implementers to accelerate broad innovation, inclusion, and adoption. This means a diverse, active, and collaborative network of health actors deciding what comes next in the CHT roadmap, like AI integration or climate resilience or disease surveillance, all driven by country priorities. It means more resources for partners and governments alike to take the CHT and independently build and deploy the tools they need for their community quickly, cheaply, and easily. I hope in the near future I can join you again on this stage to celebrate what's working and share our collective progress in advancing health for all in the digital age. Thank you.
Congratulations, that's really very encouraging. It's nice to be able to get some good news. I'd now like to welcome to the stage a very special guest. This is a woman who, for many of us, as we were starting out in our careers, really helped give us a new way to present ourselves. Rather than silly little ties trying to look like men, she gave us beautiful dresses to make us feel confident, and she continues to push forward in business and philanthropy. Ladies and gentlemen, please welcome to the stage Diane von Furstenberg.
I'm actually not quite sure what I'm doing here. I think I was asked to come here to amuse you, somewhere in between this very serious thing. And, okay, I was supposed to talk to you about age, all right? So I'm 77. although I really should be, the way I've lived, I should really be 200. I am a designer, so I design dresses that a lot of you have worn in their lifetime. But I guess I get my PhD about designing life. Life is very, very important to me. And maybe the reason why I honor life at every moment of my life is because of my birth. 18 months before I was born, my mother was in Auschwitz. She was 22 years old. She had been a prisoner there for 13 months. She weighed 49 pounds. She couldn't move. She was amongst ashes. But she did survive, and she did go back home. Her parents couldn't believe that she came back, and her mother fed her like a little bird every 10 minutes, and within 6 months she had gained her normal weight, which was always very little. Her fiancé came back, they got married, and the doctor said, you absolutely cannot have a child for 3 years, because if you did, you would die and your child will not be normal. And sure enough, a few months later, I was born. So my birth was a triumph. It was a triumph of life. And I think that has a lot to do with how I honor life at every moment of my life. So age is really life, and aging is really living. And so I made notes. I never make notes. I should never make notes because we do not choose our parents. We do not choose where we are born. We don't really choose most of the things that makes our destiny. But what we can do and what we are empowered to do is navigate it the best we can. Life is a journey. It's our adventure. And the most important thing to do to be strong and to stay strong is to be true to ourselves. It's not easy because it means that we can't be delusional. It means that we have to be tough, that we have to be disciplined. But if we are true to ourselves, and if we stay true to ourselves, we are free. Even if we are in jail, if we are true to ourselves, we are free. I mean, I never went to jail, but my mother did, and that's what she taught me. So I did not know what I wanted to do when I was growing up, but I knew the kind of woman I wanted to be. I wanted to be a woman in charge. I became a woman in charge because of a little dress. And as I was getting confident, because it was a dress, I was passing on my confidence to other people, to other women. So being in charge has always been very, very important in me, but I wasn't really paying attention. I am a feminist. I've always been a feminist, and my purpose in life is to be inspired and to inspire other women. So every year for International Women's Day, we celebrate International Women's Day. In the last few years, we call this day to be in charge. And to be in charge seems very aggressive. It means we are women and we are in charge and, you know, to the guy. But to be in charge is absolutely not aggressive. To be in charge is first and foremost a commitment to ourselves. It's owning who we are. We own our imperfection, they become our assets. We own our vulnerability, we turn it into strength. So I will give you a few tips of what it means to be in charge and how you can practice to be in charge. First, and the first thing I do every day, every morning, and I advise you to do the same because you all can do that, is try to make a miracle by connecting one person to a person they would have never met before. You don't need to leave a message, you don't need to speak, you just need to pay attention to how you write your email and how you introduce that person, and you do make miracle. The other thing is to expand. Expand your horizon by giving quality time once a week to someone that you may see all the time, but that you don't talk to. Pay attention, stop, and have some, a little moment of intimacy. And you think you do it for you, but you will expand for them, but you will expand your horizon as well. And then, of course, to inspire is the most important thing. And we know that to inspire is first and foremost storytelling. But in the storytelling, we should all know that the most inspiring stories are not our successes, but they are our challenges and our vulnerability. And every time someone gets fired, a friend of mine gets fired, or has a bad article, or something negative, bad happens to them, I always call and I always say the same thing. Remember that these moments will be your best anecdote when you write your book or you do your TED Talk. And what I discovered in life, actually, and what I would like you to think about, is that kindness is a currency, and it compounds just as money does, and it turns out to be the best investment. So I would like, in my winter in my life, I would like to promote kindness and make kindness sexy. And since we are talking about aging, I will end up with one thing. I think we all should start to, even to a child, not say, "How old are you?" but ask him, "How old have you lived?" And they say, 9 years old? You've already lived 9 years old? And if we ask that question to people, then we deal with our age with pride and not shame. Thank you.
Great words of wisdom and inspiration. Now for our second panel, we're going to talk about innovating systems to better serve aging populations, which we're also US-centric. So many of us think of it just as something here, but it's a global phenomenon. So first, please welcome Carol Osero Agengo. She's the Africa Regional Director for Help Age International. She's a human rights lawyer and gender expert. She leads regional policy advocacy on income security, healthy aging, and inclusiveness for global people. Carol. And next, let's welcome Tuesigia. I'm sorry if I mispronounced your name. Jackson Kaguri. He is the founder and CEO of Niaka. He's from Uganda, also went to Columbia and Harvard. Very long journey to become someone who really has been committed to helping combat issues facing people in health and aging. In 2001, he founded Niaka in Uganda to combat AIDS. Now they provide free education, health care, microloans to over 20,000 grandmothers. I love that. And last but not least, in the center is Jonathan Reckford. He's the CEO of Habitat for Humanity International. Since he joined in 2005, they've gone from serving about 125,000 people to 13.4 million people in all 50 US states and 70 countries. Please welcome our panel. Carol, I have to say, when I think about Africa, I think, well, does Africa have an aging population? It's one of the youngest areas on the planet. So how is aging a problem in Africa?
Thank you, Bertha, and hi, everybody. I think aging is a reality in Africa, and it's a reality by the fact that it's ignored. So it's a problem in waiting, just as the young people in Africa are older people in waiting. Africa has the youngest population, that is true, and 70% of the population in sub-Saharan Africa are below the age of 30. Africa makes its policies with the young people in mind. If you've been to Africa lately, Africa is a huge construction site. Everywhere there is construction going on, but it is not thinking about the aging population. I keep thinking, I bring the construction because I have friends who do not know what to do because they know access is very difficult, and as you grow older, access becomes a challenge. So this overpowering statistic means that with the rapid urbanization in Africa, we're going to have a problem in our hands because this 70% will grow old all at once, and we're not ready for them. So we have to put an aging, we have to think of this from an aging perspective, but also we have to remember that life expectancy in Africa is increasing, longevity is increasing. So how do we ensure that the populations, the future populations that will be made of older people and younger people are able to coexist in a way that still thinks about the development of Africa, the well-being, the socioeconomic perspectives of the entire population. So we have to think about changing the narrative on aging so that we harness the knowledge of older people currently, but also prepare for the younger people today who will be the older people tomorrow. I think the other thing that we have to think about is that aging does not happen in a vacuum. Whether you're in the private sector, whether in the government, whether you're in the non-profit area, you have to deal with aging, whether it's from the employment perspective, or even just we heard about the employment app, but also when you're thinking about the policies for developing the country moving forward, the continent moving forward. Africa is agricultural. A lot of the agricultural dynamic is held together by older people. When the younger people become older, unless Africa is going to industrialize in a flash, then we're going to have another problem in our hands. But we're looking positive. We're looking at what's working. So we're investing in the potential of older people. So we're working with young people through intergenerational engagements so that young people come into this space, walk into the older ages without some of the challenges that we face as older people, the older people that we're working with. So the prospective aging of younger people is also allowing us to bring in perspectives such as the technological, and we've heard a lot about that today, but we need to increase it some more. We have to tap into that potential and leverage that opportunity a little more. Do you want me to go on?
Let's bring in Jackson for a moment, and then we'll continue the conversation. So in Uganda, I love the fact that you are giving microloans to grandmothers, because we usually think about just mothers and women with children, and we know that when women are given that economic opportunity, it really helps the community. Why have you focused on grandmothers?
That's a good question, Martha. Thank you so much for moderating this panel. Thank everybody for coming. Why grandmothers? Our organization in Yaka started as an organization for children whose parents had died of HIV/AIDS. The question you asked earlier, in Uganda, most of the people between 15 to 49 died of HIV/AIDS in 1990s and 20s below, leaving children of about 2 million children who now have no parents but must still be raised. So why grandmothers? I wanted to help children. I love children. I have 4 of them. And as the children started coming to our schools, we realized they are walking miles and miles. So I went house to house in the village where I was born and raised by a woman who could not read or speak a word in English, but sent all of us to Columbia and Harvard. But these children didn't have where to live, so I went and begged grandmothers in our communities to house these children. And as they met every 2 weeks to talk about their children and what they are doing, we realized each of them came making baskets. Others had pottery. They talked about their tomatoes and onions. And we came up with an idea to economically empower them so they can have something to feed the children. But now we end up with 23,000 entrepreneurs through partnerships around the world. So why grandmothers? When we invest in these women, children have something to eat, husbands have jobs, community has now health care centers. We built a clinic so they can have access to medication, and so we empower them so they can empower the rest of the community.
That is really exciting. You know, in the last panel, we talked a lot about healthcare, because certainly as you age, you face health challenges often. But housing is a real issue. And you know, you're talking about urbanization, and there are many places here in the States where it's difficult for people to live multi-generationally. You know, people who are lucky enough to have a house where they can have the mother-in-law suite and do that. But if you're living in a 1-bedroom or 2-bedroom apartment in an urban center, it's a lot more difficult. What are some of the things that you're seeing, and what are some of the innovative ways that we can think about this, especially in places where they're building new cities?
It's a huge issue, and we see housing as really a driving social determinant of health, as we talked about, because if you don't have safe, stable, and affordable housing, it's incredibly hard to stay healthy. And what we see are, with housing, particularly in the last 5 years in the US or across the global north, housing costs have exploded. That then forces really impossible choices around, can you afford your air conditioning bill? We're seeing extreme heat becoming a huge issue for vulnerable elderly. In the cold winters, you're seeing the inverse. We're seeing, it was interesting and instructive when hospitals were paid for outcomes as opposed to outputs. They actually started looking at their most expensive cases and realizing they were only treating the symptoms, and they actually needed to go and remove mold, do repairs. I remember visiting a low-income veteran in Memphis, Tennessee, and owned his home but couldn't afford to keep it up. You know, he had a leaky roof and had literally a gaping hole in his bedroom floor. And so relatively modest cost, you can make a dramatic difference in the health quality. And so we are seeing, we did a partnership with Johns Hopkins and the Robert Wood Johnson Foundation where we combined in-home nursing services with small home adaptations, and we saw dramatic improvements in both quality of life and health care. And I think it is, and to tie to my colleagues in the Global South, often there we've got a rural issue where young people have moved to the cities, left behind, and you've got, we have vulnerable families living in really terrible conditions. And so the ability to give them, help them with even moving from a dirt floor to a cement floor, moving to a proper roof, moving to proper water or sanitation, all of those have quite significant health impacts.
Is there some place that's working, or some model, Carol, as people look at, you know, these new developing communities to try to build in something that's more intergenerational, that makes it easier for people to care for their loved ones? I guess, you know, from what I have seen in terms that often the people who come to work here as caregivers from Africa, from the Caribbean, from Latin America, they are the most caring folks, and yet they've often left someone at home behind so that they can send money home.
One of the things that we're doing as HelpAge, and we work in close partnership with AARP and HelpAge USA, is to put together, or rather support, older people's associations. Initially, we started off with older people coming together and speaking their own language and doing things that were familiar with them. But as these have developed, we've seen an increasing number of younger people wanting to come in for the same reason that you see. I've got a grandmother, I've got an older parent, I'm working, probably taking care of somebody else in my work or engaging with someone else who's older, and I'd like to transfer that knowledge and experience to those that are close to me. We have seen an increase in that. HelpAge is also a global network in 98 countries of about 200 network members all over the world. In Africa, there's about 69 of the network members. And what we've seen increasingly are young people's organizations joining the network. So whereas before we just had older people's or organizations working on aging, we have younger organizations coming. Uganda, we have Rahu, Reach a Hand Uganda, that is holding intergenerational dialogues at a national level that attracts the interest of the president, who's an older man. And we also have several others spread across. And we've seen that these are models that could be replicated because we're seeing the issues such as the rights and policy issues being addressed across the generations. So we get a lot of energy from the younger people to push the policy advocacy at national and even global and regional levels.
That's very exciting. We are almost out of time, so I'm going to ask each of you very quickly, give us one actionable thing that we can do to push this forward. I'll start with you, Jackson.
The actionable thing is to create more partnerships. When you look at 20,000 grandmothers raising 96,000 children, and in 5 years we want to go to 100,000 grandmothers and extend it to national level. That requires government to be involved. It requires more partnerships. We already partner with some of the people that are here. So join us so we can get all grandmothers to not just age at home, but to age with dignity, and those who die to die with dignity because they deserve it. We all have a grandmother. I've met only one person in my life whose grandmother he didn't like. Everyone else I've met in the entire world loves their grandmothers. And more reason, these grandmothers love their grandchildren. So while we take care of them, we are also taking care of the next generation that's going to grow. Look what Carol, my sister here, she's using technology. I'm using pen. We need technology for these grandmothers to create their banking systems through PESA, through mobile money. We need more money in the bank so they can borrow and invest and grow more food. And that's how we are going to sustain our communities and sustain the nations that we are serving.
Jonathan?
I'll build on that, and very closely related. We think actually in the Global South, access to the finance to be able to do small upgrades to make homes more adaptable would have the most dramatic impact. And actually our initiative this year builds on an initiative from 12 years ago at CGI, which is to extend global housing microfinance. And there was a view that basically only about 5 to 10% of families in all low and middle income countries have access to a home loan. And what we found is the mostly women who borrow the funds make their houses safer and healthier. And we've helped actually over 1 million people directly, and through the add-on investments, several million more be able to do home upgrades to be able to make their homes safe to stay in. And I think we're a housing organization, so you'll be shocked we think housing is the answer. It obviously is not the answer, but if we don't have safe, healthy, and dignified places for people to live, it's very hard for all the other things we want for our aging populations to be safe and healthy.
All right, well, we are out of time, but Kara, you already gave us some really good talking points, and I love the fact that we're talking about women, because so often we are the ones who outlive, and so we really also need to be part of shaping our futures. Thank you all for a wonderful conversation that was far too short, but let's hope we continue it. And also want to thank all of you who stayed with us, but do make your way to the grand ballroom for Dr. Biden. Thanks.
play house music. I was supposed to make an announcement. I just didn't have it pulled up. I'm pulling it up now. What'd you say, Fletcher? Take a break. All right. Yeah, it's just on here. All right.
Join us in the Grand Ballroom now to find your seats for Dr. Jill Biden, President Lula da Silva, and more on the CGI main stage.